Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, we're continuing our series on hereditary angioedema, or HAE, a rare and potentially life-threatening disease caused by unpredictable swelling attacks that can involve the skin, gastrointestinal tract, or even the airway. For many years, long-term prevention often meant frequent infusions. But today, allergists and immunologists have a much broader set of targeted, convenient options to help patients reduce attacks. One update you may not know is that 2025 has truly been a standout year for HAE. 3 new FDA approvals, Andembry, Actely, and Takhzyro, have already been granted. Actely is an oral on-demand therapy, while Andembry and Takhzyro are injectable prophylactic therapies. In earlier episodes, I covered Andembry, Actely, and Takhzyro in detail. If you have not seen those videos yet, you will find the links in the description below. In this episode, our focus is Takhzyro, one of the most commonly prescribed long-term prophylaxis treatments for HAE, with approval down to age 2, making it a practical option from early childhood through adulthood. In this video, I will walk you through 5 key things you need to know about Takhzyro, what it is, how it works, how to take it, important warnings and precautions, and its safety profile. And if you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Takhzyro and who is for? Takhzyro, also known as Lanadelumab, is a biologic monoclonal antibody approved by the FDA as a long-term prophylactic treatment to reduce the frequency and severity of HAE attacks in adults and children 2 years of age and older. Unlike on-demand medications that are used once swelling begins, Takhzyro is taken on a regular schedule to keep attacks under control. It was first approved in August 2018 for patients 12 and older, and the indication later extended in February 2023 to include children as young as 2 years. For patients with frequent, severe, or debilitating attacks, long-term prophylaxis with Takhzyro can significantly reduce disease burden and improve quality of life. Second, how does Takhzyro work? To understand Takhzyro, we need to look at the Kallikrein bradykinin pathway, which is central to hereditary angioedema. 3 key players help explain this process: C1 inhibitor, plasma kallikrein, and bradykinin. C1 inhibitor normally regulates this pathway. However, in HAE, whether C1 inhibitor is low or not functioning properly, that regulation is lost. As a result, plasma kallikrein becomes overactive and cleaves high molecular weight kininogen, or HMWK, leading to excessive production of bradykinin. Bradykinin is the main mediator of swelling in HAE. It increases blood vessel permeability, allowing fluid to shift into tissues and causing swelling in areas such as the abdomen, face, extremities, and sometimes the throat. Takhzyro is a monoclonal antibody that binds directly to plasma kallikrein and inhibits its activity. By blocking kallikrein, it reduces downstream bradykinin production. The goal is not to stop an attack once it starts, is to lower the underlying tendency for attacks to occur, providing durable long-term protection. Third, let's talk about dosing and administration. Takhzyro is given as a subcutaneous injection and is supplied as either a single-dose vial or a prefilled syringe. Depending on age and training, it may be administered by a healthcare provider, a trained caregiver, or the patient. For adults and adolescents 12 years and older, The recommended starting dose is 300 mg every 2 weeks. If a patient remains well controlled, such as being attack-free for more than 6 months, the dosing interval may be considered for extension to 300 mg every 4 weeks. For children 6 to less than 12 years of age, the starting dose is 150 mg every 2 weeks, with a possible extension to every 4 weeks after sustained control. For children 2 to less than 6 years of age, the recommended dose is 150 mg every 4 weeks. For patients 12 years and older, self-administration may be an option after proper training. Your healthcare provider should show you or your caregiver how to prepare and inject Takhzyro before you inject yourself for the first time. For children under 12, injections should be given by a healthcare provider or caregiver. Step-by-step instructions are included in the Instruction for Use section of the package insert and on Takhzyro.com. Do not inject it unless you have been trained by a healthcare provider. And one critical reminder, Takhzyro is a preventive therapy. Patients should still keep an on-demand rescue medication available for breakthrough HAE attacks. Fourth, let's review important warnings and drug laboratory test interactions. The main warning with Takhzyro is the potential for hypersensitivity reactions. Although uncommon, allergic reactions have been reported. If a severe reaction occurs, Takhzyro should be discontinued and appropriate medical treatment should be initiated. Call your healthcare provider or get emergency help right away if you develop symptoms such as wheezing, trouble breathing, chest tightness, fast heartbeat, faintness, hives, or a rash. Another important concern involves lab testing. Because Takhzyro inhibits plasma kallikrein, it can artificially prolong the activated partial thromboplastin time, also known as APTT, in certain laboratory assays. In clinical studies, APTT changes were not associated with abnormal bleeding events, and other coagulation tests, such as INR, did not differ between treatment groups. Even though this does not indicate a higher bleeding risk, it can affect how coagulation labs are interpreted. So if you are having clotting labs checked, especially in an emergency or before a procedure, make sure your care team knows you're taking Takhzyro. And finally, let's review side effects and safety. In clinical trials involving patients 12 years and older, the most common side effects included injection site reactions, upper respiratory infections, headache, rash, dizziness, diarrhea, and muscle aches. Longer-term safety data extending up to 2.5 years remain consistent with the pivotal trials. Overall, drug discontinuation due to side effects was uncommon, and most side effects were mild to moderate. Still, patients should tell their healthcare provider about any side effect that is bothersome or does not go away. Injection site reactions were the most frequent side effect and typically involved pain, redness, or bruising. Importantly, rates were similar whether injections were self-administered or given by a provider. In the open-label extension study, no patients stopped treatment due to injection site reactions, and most injection site reactions resolved within 1 hour to 1 day. Elevations in liver function tests were observed in a small number of patients compared with none in the placebo group. These changes did not cause symptoms and were temporary. Only one patient discontinued Takhzyro due to elevated liver enzymes in the trial, and no serious liver-related adverse events were reported. In a pediatric open-label study of children 2 to 11 years of age, treated for up to 1 year, no new safety signals were identified, and no serious adverse events or treatment discontinuations were reported. And there you have it, 5 key things you need to know about Takhzyro, a monoclonal antibody that inhibits plasma kallikrein and is approved for long-term prophylaxis of hereditary angioedema in adults and children 2 years and older. With flexible subcutaneous dosing and a manageable safety profile, Takhzyro remains a cornerstone option for HAE prevention. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the comments below. Thanks for watching, and stay tuned for more evidence-based updates right here on Medician. See you next time.